Hey everyone, welcome back to Medcase Chronicles. Where real world medicine meets compelling storytelling. I'm Dr. Yatish Jadhav, and today we are diving into a fascinating case that led us to a rare diagnosis but serious diagnosis of familial adenomatous polyposis or FAP. So buckle up as we follow the clues, examine the evidence, and arrive at a final answer. So a 17-year-old boy named Arjun walks into our OPD accompanied by his father. His chief complaints: painless rectal bleeding off and on for last 6 months. Bright red blood, not associated with any pain, initially ignored but now occurring almost daily. No history of constipation, diarrhea, or weight loss. Any family history of bowel problems or cancer? The father said his grandfather died of colon cancer in his 40s, and now that you mention it, I had the same polyps removed when I was younger but didn't think about it much. The doctor asks, that's clue number one, a strong family history and the fact that Arjun is only 17. Colorectal cancer this young is rare unless there is an inherited risk. The Arjun general examination was unremarkable. There was no pallor, no lymphadenopathy. Abdomen was soft, non-tender. Digital rectal examination showed traces of fresh blood but no mass. So, the doctor ordered basic labs like CBC with hemoglobin, which showed 10.5 gram %. So there was mild anemia, no leukocytosis, normal platelets, and stool for occult blood came positive. So the next step in the process was colonoscopy. What the colonoscopy revealed stunned everyone our experienced gastrointestinal team. The entire colon, from the rectum to cecum, was carpeted with hundreds of small polyps. No single dominant mass, but polyps everywhere. This was classical for familial adenomatous polyposis. We are looking at well over 100 polyps, and that's diagnostic. Boom. Diagnosis essentially clinched, but before we label it, let's break down what FAP really is. Familial adenomatous polyposis is a hereditary condition caused by mutation in the APC gene, usually inherited in an autosomal dominant pattern. Affected individuals develop hundreds to thousands of adenomatous polyps in the colon and rectum often starting in the adolescence. If untreated, the lifetime risk of developing colorectal cancer approaches 100%, often before the age of 40, and that's why early detection is crucial. Once FAP is suspected based on the colonoscopy, the next step in the process is genetic testing. Arjun underwent APC gene testing, and yes, he had a pathogenic mutation. Now comes a cascade of testing. Both parents were tested. The father was positive, meaning he's the source of mutation. That makes it a familial case, not a de novo. The Arjun's 12-year sister was also tested. She tested positive even though she had no symptoms. Colonoscopy in her case already showed a few polyps forming early stage FAP, and this is how genetic medicine saves lives. The treatment for FAP isn't just about removing polyps, it's about preventing cancer. The cornerstone of is prophylactic colectomy, surgical removal of colon. Sounds drastic, but Life-saving? Absolutely. There are three common surgical options: total proctocolectomy with ileostomy, colectomy with ileorectal anastomosis, proctocolectomy with ileal pouch anastomosis. The most common choice for young patients. In Arjun's case, IPA, that is ileal pouch anal anastomosis, was performed and he recovered well. FAP isn't limited to colon. Patients can develop duodenal and periampullary polyps, desmoid tumors, especially post-surgery, congenital hypertrophic of rectangular pigment epithelium, that is CHRPE, thyroid cancer, hepatoblastoma in children. So surveillance isn't a one and done, it's lifelong. So Arjun now gets annual upper GI endoscopy, annual thyroid ultrasound, regular pouch surveillance, nutritional support, genetic counseling for future family planning, because medicine doesn't end with diagnosis, it continues with management and education. So what we learn from Arjun's story is never ignore rectal bleeding in adolescents, always ask about family history. FAP is a silent killer until it's not. Genetic testing can save not just one life but entire families. Early diagnosis and preventive surgery, that equals to near normal life expectancy. Thanks for sticking with us through this deep dive into familial adenomatous polyposis. If you found this helpful, please hit that like button, just subscribe for more real life case stories and share this video because awareness saves lives. I am Dr. Yatish Jadhav and this was MedCase Chronicles. Until next time, stay curious, stay kind and always think critically. Thank you.